Hello and welcome back to our channel with a new video. Today we will discuss all you need to know about depression in all ages. So without further ado, let's start with today's video. Depression, like many other health issues, is a sort of mental disorder that affects people of all ages. Anyone of any age, whether a toddler, teenager, adult, or senior citizen, can be affected. According to the World Health Organization, WHO, more than 264 million individuals of all ages worldwide suffer from depression. If you are one of the 14.8 million adults in the United States who suffer from depression, your condition may be so upsetting that you are unable to leave your bed, be with the people you love, or engage in the activities you enjoy. In reality, depression manifests itself in a variety of ways, from the well-known sadness and sobbing, to symptoms that may or may not be related to melancholy, such as anger, back pain, and workaholism. Causes. Depression isn't merely a state of mind that can be overcome. According to Angelino, it is a disease in which the brain is unable to recognize enjoyable actions. MRI examinations of people who suffer from depression reveal alterations in various brain areas that are thought to play a role in the disorder. Risk factors. When compared to men, women have twice the likelihood of being diagnosed with depression. Also, if a person is 45 to 64 years old, divorced, or non-white, has not completed high school, is unable to work, or is unemployed, and does not have health insurance, they are more likely to get depression. Other depression risk factors include 1. Dealing with stressful conditions in life, such as marital problems, job loss, financial difficulties, or major health issues. 2. Some personality qualities, such as being excessively disturbed when under stress. 3. Those who had a difficult upbringing, such as one that included abuse, an unhealthy relationship with their parents, or parents who had marital issues. 4. Individuals with a past family history of this condition have a 3 to 4 times higher risk of developing depression. Overall, depression is far more frequent than most people realize, with nearly 1 out of every 10 adults experiencing depression at some point, and over half of those experiencing severe depression. Depression frequently starts when a person is a child. MDD, or major depressive disorder in children, 5 to 12 years, is a challenging and serious disorder. Most adult diseases have their roots in childhood, according to studies, and most childhood problems have implications that last into old age. In addition, MDD that develops in children aged 5 to 12 years might be severe and result in lower results than MDD that develops later in life. According to the National Mental Health Association's campaign on mental health issues, no single factor can induce depression in children. A history of depression in the family, stressful events such as divorce, the death of a parent, or discrimination, as well as extra psychological and physical concerns, can all contribute to this condition. Children who were mistreated, abused, or exposed to various traumas as a result of chronic illness are more likely to develop depression. According to Fassler, 75 to 80% of children with depression can be successfully treated with a multi-pronged approach for the child, family or school counseling, and antidepressants. Depression symptoms at different ages. The indications and symptoms of depression are not the same for everyone who is suffering from it. These might vary a lot from one person to the next, especially among different age groups. Children aged 5 to 12 years. Changes in mood, thought, and activity that is sufficient to impair personal and social functioning are typical underlying aspects of depressive disorders in childhood, adolescence, and adulthood. However, depending on a child's developmental level, there are significant variances. Younger children are less likely to appear depressed. Although children may deny feeling sad, they do admit to feeling down or grumpy. Children with depression often find it difficult to speak positively about themselves and blame themselves for their problems. Children are more likely to present with somatic symptoms and are less likely to talk about subjective feelings, example, headaches, abdominal and musculoskeletal pain, fatigue. Mood lability, anger, and temper tantrums are more common in children than depression. Lack of interest might present itself as a lack of desire to engage in pleasurable activities, such as seeing friends. Sleep disorders, concentration difficulties, and food disturbances are all possible symptoms. Moving and walking slowly, as well as restlessness, are examples of motor affection. Guilt, fear of bad things happening, being a bad person, loathing themselves, believing no one loves them, and unpleasant comments about themselves are all examples of cognition affection. Domestic violence, abuse, divorce, parental despair, relocating to a new school, and the loss of a loved one are all potential triggers for depression in children. As previously said, depression in children can be treated. If you suspect your child is sad and in need of assistance, ask his school counselor or a pediatrician to send him to a child specialist. Teens. While mood swings are common between the ages of 12 and 18, you should be aware of any mood changes that last longer than 1 or 2 weeks. Many of the same life difficulties that affect young children can also cause this condition in teenagers. Teen depression can be caused by pressures to mature and succeed, to fit in, hormonal and sexual worries, peer rejection, and a lack of sleep. School problems, feelings of rage, worthlessness and sensitivity, excessive eating or sleeping, avoidance of friends, self-harming behaviors, or substance abuse are all common indicators. Parents should take seriously a teen who talks about death or dying, or who gives up favorite hobbies or writes goodbye messages. Teens may even attempt to flee their homes. If you notice similar signals in your teen, you should approach him or her gently and take him or her to the doctor to see if the symptoms are linked to a medical condition such as hypothyroidism. The doctor may also recommend him or her to a therapist if this is not the case. For a diagnosis of depression, not all of the symptoms listed above must be present. Symptoms normally last at least 2 weeks and occur on most days. Adults. Major life changes, interpersonal issues, a lack of support in a new area, trauma, employment troubles, and other factors can lead to depression among young adults aged 19 to 29. Adults in their 30s and 60s have a lot more going on in their lives, such as caring for children and aging parents, relationship and work troubles, menopause, illnesses, additional obligations, and financial stress. Some people may demonstrate alcohol or drug misuse, hostility, or abusive or violent behavior in addition to the normal symptoms. Also, depression in senior adults is not a normal part of growing older, but it is very frequent and often goes untreated. Anxiety and sorrow are common symptoms at this age, as are exhaustion, persistent mood swings, and difficulty sleeping and concentrating. Physical aches and pains are also frequently regarded as signs of depression. These senior folks typically develop depression as a result of dealing with common late-life issues such as social isolation, loss of loved ones, financial stress, health issues, and medicines. Encourage them to develop a strong support system, discuss their concerns with their doctor, and maybe seek professional help. Still, need more information on this topic? Don't worry. We have got you covered. Check out the links in the description box below to learn more about our resources and other helpful materials. Before you go anywhere, make sure to give our video a thumbs up and also subscribe to our channel and click on the bell symbol so you don't miss any of our intriguing videos. Stay tuned until next week.